The situation in the DRC is an ongoing crisis situation. It's had several decades of conflict, and more recently in the eastern part of the country, in the North and South Kivu region, and also in Oriental, there's been a number of armed groups operating, which has resulted in an increase in sexual violence in the country. It's now been called the rape capital of the world. Australia for UNHCR is addressing sexual and gender-based violence in the DRC because for UNHCR, protection is their core mandate, and sexual and gender-based violence is probably the most critical protection issue in the DRC today. The fact that, for instance, in one camp I visited, 28% of women had been raped, and several decades of conflict mean that there are many vulnerable and traumatised women there, and there's a lot more women at risk as well. So we are committed to changing community attitudes and funding prevention and response programs to help these women. UNHCR is the lead agency for protection in the DRC, and underneath that we address sexual and gender-based violence. We have a number of prevention, awareness raising and response programs. One of our awareness raising programs is we fund a participative theatre group in North Kivu, and this theatre group travel around to raise awareness of sexual and gender-based violence issues such as early marriage, survival sex and rape. Another response activity we focus on is in terms of medical care and psychosocial counselling. So if someone is a victim of sexual violence, we provide a counsellor. There's usually 5 counsellors per camp, and victims have the opportunity to meet with a counsellor and also to receive medical care, which is particularly important in the first 3 days. UNHCR funds a number of livelihoods and income generation programs for vulnerable women. Working with our partners, we have a number of projects in Oriental. We have a bakery funded by UNHCR and its partners that produces loaves of bread, where women in a cooperative have the opportunity to buy the bread and then sell to the village. And another example is the agricultural program, where vulnerable women receive a small plot of land and harvest vegetables to sell to support themselves and their families. So through these programs and numerous other livelihood and training programs, we're seeing, and women are telling us themselves, how their lives have been transformed and they feel so much more empowered, that they're so much more in control of their life and they can support their families. So it's a wonderful outcome. With ongoing support and additional funding, we can reach more women, we can provide more access to livelihood programs and vocational training, we can increase access to natural resources. So for example, if we provide say 80 stoves, women don't have to leave the camp in search of firewood and putting them at great risk of sexual violence. We can increase the number of counsellors in the camps, we can increase medical care in terms of response, and we can work a lot more on engagement and community awareness about the issues.